Okay, so one of the things we haven't pointed out yet would be the two atria, or in this case, we call them auricles, and we have them right here. So this structure here, as well as this structure here, you can see I'm lifting up on it. Those would be the atria, the upper chambers, or we call them auricles as well. What we're going to do is we're going to make a cut. We're going to cut the atria open so that we can see inside. And again, you'll see that I'm using the scissors. I'm trying to keep the tip pointed upwards. Okay. Remember that the heart is muscle. Now this yellowish white is fat around the heart. It is normal to have some fat around the heart because it helps cushion the heart. What we would not want to see is an overabundance of fat around the heart because that can lead to other issues. But if we can, let me try to, I do have this open, going to try to get it so that you can see inside here as well. So here we go. You can kind of, I know you can't see much in there because it is dark, but you can see that we have that right atrium open. I'm going to do the same thing on the left side. Remember that it is muscle. So what I'm cutting through right now is muscle, okay, cardiac muscle specifically. So when you're hearing that snip, that is cutting through the muscle. Okay, let's get a little more into there. Okay, so now you can see, if I can get it where I can show you. Okay, we're starting to get into that chamber, which is right below here. Okay, I'm going to down the right-hand side of the heart. I'm going to continue that cut. I'm going to cut the ventricle now, cut that open. We will be able to see the valves inside of the heart and we'll review what they are. So again, we're going to use the scissors to do that. So I'm going to use the larger pair of scissors since it is thick muscle we're going to be cutting through. I'm going to go through the opening where I started with the atria. Okay. Remember that you need to keep the tip upwards. I know you're not actually doing this, but I would be telling you that if we were. Okay, so let me see if I can get this where you can see inside a little bit before I continue on. All right, so now I have the front and back half of the heart, or anterior and posterior, ventral, dorsal part of the heart opened up, okay, separated. So if we open that up, ta-da, okay, this is the back side of the heart, so we'll take a look at that. This is the right ventricle down here. Okay, you can see that the wall of the right ventricle is thinner than the wall of the left ventricle. Okay, this would be the left ventricle in here. If you can kind of see, it's shiny inside. That smooth surface is there to help reduce the friction of blood as it flows through. Okay, let me try to open that up a little bit more and keep my gloves out of the way so you can see inside of the right ventricle there. This would be the interventricular septum. okay, separating the right and left side of the heart. Again, that septum keeps the right and left separated. That will keep the blood from mixing, the blood that's returning from the body and the blood that's returning from the lungs to be pumped to the rest of the body. So on this side of the heart, usually when we're seeing a diagram of the internal anatomy of the heart, this is kind of what we're looking at. So we're going to go through those structures. So up here, how you can see if we turn it over really quick, this would have been an atrium, the right atrium. So blood enters into the right atrium. There would be blood vessels entering here, which the hearts that we get don't have them remaining on them, unfortunately. But the inferior and superior vena cava would enter, the blood would enter into the right atrium. The inferior vena cava brings blood from the lower part of the body. The superior vena cava brings blood back to the right atrium from the upper part of the body. Blood would then be pumped right through here. You can see the remnants of the tricuspid valve that I cut through. We can see that better on this side. So I'll show you on the front. Okay. Right here, what I'm lifting up. Okay. That is part of the tricuspid valve, one of the flaps of the tricuspid valve. Okay. They are pretty strong and tough. Like I'm really pulling up on that and it's not, I mean, you can kind of hear it tearing a little bit, but it's not meant to be pulled up on that, like on there like that. We've got your little flaps. Okay. We'll talk about those in just a second. So that would control the passage of blood from the right atrium into the right ventricle. Remember, this is the front of the heart. So this would be the right side on this part of the heart. So blood would be pumped from the right atrium through the tricuspid valve into the right ventricle. Okay. From there, blood would be pumped through another valve, which let's see if I can find our way. Okay. So we have right here. Okay. I'm going to put the probe through that vessel and we're going to see it come out in the right ventricle. Okay. So right now this probe is through the pulmonary artery. Okay. Blood gets pumped. There's a valve there, pulmonary valve that would be opening as the ventricle is constricting or contracting to pump blood through there into the pulmonary artery to carry blood to the right and left lung. Okay. From there, blood would come back through the pulmonary veins. And if you remember, the pulmonary artery and the pulmonary veins are the blood vessels we talked about where normally your arteries have oxygen-rich blood and your veins have oxygen-poor blood. But with your pulmonary arteries and veins, that is switched. So the pulmonary arteries carry blood away from the heart, veins return blood to the heart. So normally that works as far as talking about oxygen-rich versus oxygen-poor blood. But the pulmonary artery, let me go that way. There we go. The pulmonary artery carries blood away from the right side of the heart to the lungs, and that is oxygen-poor blood. Then we would have oxygen-rich blood coming back from, there's two right and two left pulmonary veins that return blood up here to the left atrium. Okay. Blood then would get pushed through the bicuspid valve, which you can see here. Okay, let's try, there's a flap from the bicuspid valve. Okay. And I'll mention these again now because we can see them really well here. So that's why I was trying to wait. Okay. These cords, I'm trying to make it so you can hear like how, I know it doesn't make sense to hear how tough something is or strong something is, but okay, if you can hear that, I'm using the probe, I'm going along those. Okay, those cords are our chordae tendineae. The chordae tendineae are going to help with the valve opening and closing. And then you would have the papillary muscle right here. that they're attached to. So the blood would flow from the left atrium through the bicuspid valve into the left ventricle. Okay. Then blood would go out. Let's see. Through, here we go. Through the aortic valve. Okay, and I have that going back so you could see where that would flow and where it would come out. Okay, on the back of the heart. That aorta would curve up and around. You would have branches going to the upper body, and it would curve around behind the heart and go down to the lower part of the body. Okay. So blood would flow through there, go to the body, go through from arteries, arterioles to your capillaries, venules, and veins, and then inferior and superior vena cava back to the right atrium. Okay. So we'll go through a couple other things here. So again, this is the front of the heart. Okay, and I just want to point out a couple more things to make it hopefully a little easier for you to see. Here's another part of the left side, that valve, the bicuspid valve there with the chordae tendineae. Okay. Again, you can see how smooth it is on the inside, and that just helps again reduce friction. The way you can tell the right from the left when you see the internal anatomy is the right ventricular wall is thinner than the left ventricular wall. Okay. And again, that's because the right side only has to pump blood to the lungs, which are on either side of the heart. The left side has to pump blood out to the entire body. Other than that, we can look at a couple blood vessels here. So you can see that they're actually tubes. Like here is, that would be, let me see where that's going. Right, that's the pulmonary artery. Okay, so you can see that it's a tube. The wall is fairly thick. Let me cut part of that off and we can take a look at that. Okay, so not a great section. Good job, Miss Hal. All right, we'll go a little further. Okay, so again, that was the pulmonary artery. That would carry blood away, because it's an artery, away from the right side of the heart. It would branch and you would have a right pulmonary artery and a left pulmonary artery. Here we go. Let me just get some of that fat cut off. Okay. Just pull that. It does not want to come off there. There we go. All right, so here we go. Okay, part of the pulmonary artery. Okay, so you can see that it's a tube. Okay, blood would pass through there from the right ventricle on its way to the lungs. Okay, so remember the tunica media, that middle layer is thicker in an artery than it would be in a vein. So these walls of an artery are thicker than the walls of a vein would be. Again, that's just so you can see that the blood vessels are actually tubes. Okay. So we went over again, the outside of the heart, front or ventral, back or dorsal, right side of the heart, left side of the heart. Can we open that up? You have the right ventricle and left ventricle. The right atria is up here. The left atrium is up here. You have a valve separating the atria from the ventricles. Tricuspid on the right, bicuspid on the left. The interventricular septum would separate the two ventricles. There's an interatrial septum as well that keeps the blood in the two atria separate. And the septum is really just a wall. Okay, it keeps that blood from mixing. Blood then leaves each ventricle to leave the heart to either go from the right side to the lungs or from the left side to the rest of the body. And blood would have to be pumped through a valve on there as well. But with the way we have these hearts, it is often difficult to find those other valves. So let me take one more look to see if I can find them. Okay, usually all we get is bicuspid and tricuspid. So let's see. I can try and cut it open. Why not, right? No, because usually they don't give us enough of the aorta. So there would be a valve there, an aortic valve, okay, that would control the passage of blood from the left ventricle into the aorta. But again, they don't give us enough of that aorta there to actually see where that valve would be. And we had the valves there with the chordae tendineae here. Okay. And they're fairly strong. And they just help to kind of push up on the flat valve of the valves to close them or allow that to relax so that they can open and blood can go from the atria into the ventricle. I know this definitely isn't as good as doing a dissection yourself, but hopefully at least gives you some part of the experience.